I call the member for Wagga Wagga.
Mr. Speaker. Thank you, Mr. Speaker. It is with pride and hope that I present this petition to the New South Wales Parliament that calls on the government to address the unfair situation that means that Wagga Wagga, the Riverina Cancer Centre, is the only New South Wales regional radiotherapy centre where patients seeking their life-saving, pain-relieving cancer treatment have to meet out-of-pocket costs. A situation that means the most vulnerable in our community, when they are at their most vulnerable, have to deal with the added stress of finding money for their treatment. Mr. Speaker, 12,000 signatures from our region say that this is unfair and we are calling for it to be fixed. And let me start with the history, Mr. Speaker. The Riverina Cancer Care Centre was established 20 years ago. It was built with $6 million raised directly from the community, a stunning achievement. The community arranged for the centre to be run by a private provider. There was no public provider available at the time, but that meant that an out-of-pocket cost was charged. Now, at the time, I know the community wasn't happy. They'd raised all the funds for the building, but it was generally accepted, and this is my view, that people were so relieved to not have to travel to Sydney and spend weeks fighting cancer away from their families that they saw the enormous benefit to the community. And I personally remember the primitive cancer treatment facilities in our region and the torment that people suffered having to travel to Sydney for long periods of radiotherapy treatment without their family and their loved ones to support them. And this facility changed that. And in a real way, the efforts of the people of the Riverina led the way for the state. The establishment of the centre in Wagga Wagga confirmed how important it was for people to get treatment close to home. Otherwise, people would often choose not to get the treatment that they needed. And now we have a range of facilities in regional New South Wales run by the state government, and these facilities do not have out-of-pocket costs, and that is great. And I applaud the investment by the government in this. And I note now that we actually have the facility in Griffith where there's a private provider and there won't be out-of-pocket costs. But sadly, 20 years on, people attending the Wagga Wagga Centre are still paying out-of-pocket costs. And in this day and age, it's just not acceptable. The community should not be punished for funding their own cancer centre 20 years ago, and that's what it feels like. It's meant that our communities had to support patients, and I want to acknowledge the work of CanAssist, and there are members here from CanAssist in the gallery. Their volunteers have basically picked up the slack to help people fund their treatment. And I also want to acknowledge Amy Glynn, a lady who is not here today but is, I'm sure, watching online. Amy told the ABC that she had to pay $5,000 for an initial consultation for her non-Hodgkin lymphoma and then paid an additional $1,300 a week during her treatment. She acknowledges she was one of the lucky ones who could afford these costs. And obviously there were rebates through private health insurance and Medicare, but those upfront payments are a hefty financial burden that many have to overcome that scare people, especially people who don't have the means, and there's still a gap to cover at the end of it. And furthermore, we may see more private-public partnerships with the Commonwealth providing some infrastructure funds and then having a private provider come in, but I can guarantee you there will be out-of-pocket costs when those get set up, and the state government needs to come in and address that. Now, I understand how complicated it is, relationships between state and Commonwealth. And I get the rules that the bureaucrats put in place, but at the end of the day in rural regions, those rules often don't make sense. And I would like to see the Commonwealth state work together to make sure that where the Commonwealth do fund infrastructure, the state is supported to meet out-of-pocket costs in a reasonable way. Mr. Speaker, radiotherapy can be a life-saving treatment. It can relieve severe pain. It can prolong life. Radiotherapy is something we would all expect was there for our loved ones. We would all expect it to be as close as possible to where they live so that they can go through that treatment with the support of their families. And we would also expect that people had access to that without financial strain. This petition of more than 12,000 signatures, Mr. Speaker, calls on the government to intervene and resolve this funding anomaly and regional health inequity. and I commend the motion to take note of this petition to the House, Mr Speaker.
The question is that the House take note of the petition. I call the member for Bega.
Thank you, Mr Speaker. I acknowledge my colleague Dr Joe McGirr, the member for Wagga Wagga, who, with a shared experience as a clinician and representative in rural regions of New South Wales, acknowledged the lived experience of our constituents on this very important issue. People who live in rural and regional New South Wales can access cancer services through networks of public and private providers. The services provide prevention, screening, diagnosis, treatment and palliative care services. People with cancer in rural and regional areas are also able to participate in investigator-driven clinical trials closer to home. There are 9 public and 5 private comprehensive cancer care centres in regional New South Wales. All public centres provide services such as radiotherapy, medical oncology, clinical haematology, palliative care and rehabilitation. They also provide access to other essential services such as diagnostic imaging, nuclear medicine, pathology, intensive care and pharmacy services, and the skilled workforce necessary to provide a quality, sustainable cancer service. The 9 publicly funded rural and regional comprehensive cancer care services are located in Tamworth, Orange, Nowra, Coffs Harbour, Port Macquarie, Lismore, Gosford, Wollongong and Dubbo. The 5 private centres are at Wagga Wagga, Cancer Care Associates, Albury-Wodonga, Genesis Care, Gosford, Icon, and 2 centres at Maitland, Genesis Care and Icon. Mr Speaker, the Murrumbidgee Local Health District currently supports the provision of cancer treatments within the Riverina by over $1.6 million a year. Patients in the district are also supported by communities, non-government organisations and key cancer support partners. The Wagga Wagga Cancer Treatment Facility, known as Riverina Cancer Care Centre, was built through support and donations from the Riverina communities. The district has a service agreement with Cancer Care Associates who provide cancer services for the region from the centre. Services include inpatient and outpatient radiotherapy and outpatient chemotherapy in Wagga and outreach medical oncology consultant support in the district's chemotherapy services at Griffith Base Hospital and Young Health Service. The district also provides specialist clinicians to the centre, including cancer care coordinators, allied health professionals and specialist nurses. Wagga Wagga Base Hospital provides inpatient medical oncology to admitted cancer patients, outpatient medical oncology to treatments that are provided to patients through centre premises located in the Wagga Wagga Health Precinct on Calvary Private Hospital campus. The centre is operated as a private enterprise and has private billing policies for patients accessing cancer treatment. The centre applies a range of different billing models that allow patients to access private insurance, Department of Veterans Affairs payments and bulk billing. Some patients may be required to pay additional gap fees. Mr Speaker, the district provides the centre with an annual infrastructure grant to support access to cancer treatment for public patients. In part, this payment is intended to reduce out-of-pocket expenses for patients accessing chemotherapy and radiotherapy. The district provides a range of treatment and supportive care to patients with cancer and partners with other services to ensure patients receive the appropriate care they require during their cancer journey. The medical oncology units at Griffith Base and Young Hospitals are operated through a service agreement between the district and the centre. The medical oncology unit at Young is a district-operated service providing chemotherapy 3 days a week. The medical oncology within the Griffith Base Hospital is operated by the district and provides chemotherapy to patients 5 days a week. The centre provides medical oncologists while the district covers all the operational and infrastructure costs. The Cancer Care Group has been successful in obtaining a Fighting Cancer grant of $5.2 million to develop a radiation oncology facility at Griffith operating as Cancer Care Griffith. Mr Speaker, in 2022, the New South Wales Government reached an agreement to ensure there will be no out-of-pocket expenses for public patients attending the radiotherapy service in Griffith. The facility is expected to start operations in June 2023. The New South Wales Government is committed to providing equitable access to high-quality cancer treatment for Riverina residents. Work has commenced on the renewal of the agreement between the district and the private provider. The district prioritises access to quality cancer services for patients and families in the Riverina region and is working to ensure equitable, safe and affordable cancer care.
Yeah. Call the member for Murray.
Mr. Speaker. Mr. Speaker, I rise to speak in favour of Dr Joe McGirr's ongoing push to have radiotherapy in Wagga Wagga bulk billed. Let me start by saying this is a fight that Dr Joe should never have had. And I have a personal understanding of this fight because until recently I was facing exactly the same fight for funding in Griffith that Joe is still facing in Wagga Wagga today. Before the change of government, Griffith and Wagga Wagga were the only two places in New South Wales where cancer patients faced out-of-pocket expenses to get life-saving treatment. In every other area of the state, these treatments are bulk billed. It was never fair or equitable for the good people of Griffith or Wagga Wagga to have to find more than $400 every time they needed life-saving treatment when everyone else in the state gets this treatment, the same treatment, for free. And while the financial pressure this cost causes is unfair and outrageous, as anyone who has cared for a sick loved one will tell you, it's just not about the expense. It's also about the emotional impact of the unfairness of that expense. The unfairness upsets patients at a time when they should not be upset. Let's not forget, many of these patients are being forced to face death. How on earth can any government tell people they can only access life-saving treatment if they are willing to pay a bill that no one else in the state is expected to pay? Recently, the new state government agreed to do the right thing by the people of Griffith and provide the funding needed to ensure radiotherapy in Griffith could be bulk billed. While that is great news, it only fixes half the problem. What about Wagga Wagga? That's why I'm calling on the new state government to do the right thing by the people of Wagga Wagga and ensure that they can also access bulk billed radiation therapy just like every other person in New South Wales. Given everything else that a cancer patient goes through, surely this is the least we can all do to help people in their time of incredible need. Thank you, Mr. Speaker.
I thank the member. I call the member for Blue Mountains.
Thank you, Mr. Speaker, and I'd just like to acknowledge and pay respect to my colleague, the member for Wagga, for bringing this petition to this place, and acknowledge in the gallery those from Wagga Wagga. I'm a proud Riverina girl, went to Wagga Wagga High School as well, although now represent the good people of the Blue Mountains, but you never forget where you come from. I'd just like to, in acknowledging the good member and my respect for him, point out that I agree that rural and remote regions of Australia have higher rates of mortality from all cancers than in metropolitan areas, and acknowledge that I agree that we need to confront the geographic and socio-economic disparities that exist between metropolitan and rural areas, and agree with you that as representatives here we're tasked, we are all tasked, not just the government, with ensuring that all Australians have equity of access to cancer care, no matter where they live or what their circumstances are. However, it is important to also put on the record that not everyone who is diagnosed with cancer has to travel long distances for treatment, because we do have regional cancer centres across the state of New South Wales. And the New South Wales government we do acknowledge and care that there may be extra challenges, such as having to travel for tests or treatment, and that there are a lot of people who cannot access what they need because of their finances. Can I also acknowledge comments from my colleague, the member for Bega, that people living in rural areas have poorer access to and use of primary and secondary healthcare services than people in the cities. And I think it is incumbent on all of us who come from outside the Sydney metropolitan area to point that out in this place again and again, whether we are members of government or not, and to work with the government of the day to fix some of those problems. At this point, I'd like to point out that the Blue Mountains District Anzac Memorial Hospital, which is a very small hospital and sits under the tertiary hospital of the Nepean, is unable to provide cancer services. There are many things that we are unable to provide, and the complexity and specialisation of health services today means that small hospitals like the Blue Mountains Hospital, which is not in a metro area, but sometimes we are included in sort of Greater Sydney in different portfolios, that we're unable to provide the full range of health services requested by residents. I, at this moment, am working with my colleague, the good new Minister for Health, Ryan Park, working hard with him to provide cancer care services at Blue Mountains Hospital, because it is possible with some planning and funding. So I understand where the member is coming from, and I empathise. And I, like you, will continue those conversations with our Minister. We will continue advocating until we can provide the care that our constituents need, regardless of where we come from. I have trust and faith in this Minister, who spent, and still to this day spends time in hospitals, in communities, listening to people, understanding what the needs are, and has that huge task ahead of him of addressing, more than a decade's worth of neglect from people in New South Wales. So I'd just like to put that on the record as well. Some important points that have been covered off, but I'd like to put on the record as a girl from Wagga Wagga, that the cancer treatment facility known as the Riverina Cancer Care Centre was built through support and donations from Riverina communities. We should always remember that services include inpatient, outpatient radiotherapy and outpatient chemotherapy in Wagga Wagga, and outreach medical oncologist consultant support for the district's chemotherapy services at Griffith and Young Health Service. There are those points that we need to acknowledge. And I will finish up by just acknowledging that the previous government reached an agreement last year to ensure that there wouldn't be out-of-pocket expenses for public patients, and that is the job that we will now get on with. And I do believe that wherever you come from, across New South Wales, this government will deliver.
Thank you, Member for Blue Mountains. I call the member for Cootamundra.
Thank you, Mr Speaker. On behalf of the Cootamundra electorate, I'm pleased to speak here in support of this petition lodged by the member for Wagga Wagga. Can I acknowledge the member for his advocacy on this issue, which calls for the elimination of out-of-pocket expenses associated with radiation treatment at the Wagga Wagga Cancer Treatment Centre. The centre is, of course, accessed by people from my electorate in need of cancer treatment, and accordingly the petition has been signed by many constituents of my electorate in locations such as the Junee Post Office. I also wish to acknowledge and thank petition signatories for their support of this important issue for many regional families. We know out-of-pocket expenses are a significant impost in accessing health care. Combined with extensive travel, often required of patients in regional towns in order to gain access to the treatment needed, this can be a huge physical and emotional, let alone financial toll. Thankfully, last year, the former coalition government significantly expanded the Isolated Patients Travel and Accommodation Scheme, or IPTAS. This is already making a difference for local families, helping to reduce the financial burden on regional patients who need to travel long distances to receive specialist care, including cancer treatment. Making IPTAS the most generous scheme in the country has also eased some of the burden on organisations such as CanAssist, which had an active role amongst other stakeholders in making the case for change. And so on that note, I would like to acknowledge and commend the representatives from CanAssist who join us in the gallery today. For more than 20 years, CanAssist has been supporting patients and their families undergoing cancer treatment with out-of-pocket expenses. In the Cootamundra electorate, we have an amazing team of volunteers, which make up several of the local branches of CanAssist, including branches at Ardlethan, Cootamundra, Grenfell, Gundagai, Harden, Murrumburra, Junee, Narandra, Temora, Ungary, West Wyalong and Young Burrawa. On Daffodil Day last year, I remember meeting Catherine Goodall and Sheridan Evans of the Cancer Council Wagga, together with Liz Cowlett and Graham Beasley of Junee CanAssist. Next month, Junee CanAssist will be hosting their Ladies' Long Lunch, a fundraiser which has become a calendar highlight locally. And earlier this year, Kathy Manwaring of the Cootamundra branch opened her sunflower field to the community in return for donations to CanAssist. These are just a couple of the amazing people in my part of the world who raise awareness, advocating for and providing support to regional cancer patients and their families. Much of this work is achieved through substantial fundraising efforts. It's extraordinary, which have always been incredibly well supported by the broader community. All monies raised go to supporting local people with out-of-pocket expenses, and their reach goes far and wide. With the support of CanAssist and the improvements to IPTAS, some of the financial barriers experienced by regional patients in accessing treatment they need are eased. But more can always be done. We know the benefits of radiation therapy as part of cancer treatment, as part of the cancer treatment mix. It is a proven life-saving therapy used in 48% of successful cancer treatments. Radiation helps patients with certain types of cancer to avoid expensive and intrusive surgery. And while we are fortunate to have radiation treatment available in Wagga to support patients in the broader region, it is crucial access is not impeded by the associated costs. We've heard today that Griffith has had their local radiotherapy centre fully approved as a bulk billing centre. Quite simply, the same arrangements should apply at Wagga Wagga. The inequity from the centre to centre needs to change. I am pleased to support the petition on behalf of all of those in my electorate who signed it, and on behalf of all of those currently supporting a loved one through the fight of their lives. Thank you.
I call the Minister for Health.
Thank you, Mr Speaker, and can I sincerely thank the member for Wagga Wagga, not only for bringing this petition to the House, but I've got to be honest, his incredible advocacy on behalf of rural and regional communities when it comes to healthcare. I've had the pleasure of listening and learning from Dr Joe, as his name, to us over here, for a number of years. And I've got to tell you, I always leave a conversation with Joe more informed about rural and regional healthcare. So thank you very much, Joe. I thank you to the other members, member for Murray, a terrific advocate for her community, member for Cootamundra, and of course my good mate, the member for Blue Mountains and the member for Bega. Thank you very, very much. Look, I've got to be honest with you, I think we can do better on this. I think we can do better, and I think we need to do better. I've asked New South Wales Health to go back and have a look at this. I was first informed about this when I made a trip down to Wagga Wagga as part of my first trip into rural and regional New South Wales when I took over as Minister, and I also went and saw the member for Murray. I had an opportunity to speak to Joe about this discrepancy, and it doesn't make a lot of sense to me, if you want me to be brutally honest about it. And I've asked New South Wales Health, in the spirit of what new ministers should do, to go back, examine this and pressure test it, because I think we can do better. And what we've got to start to realise in rural and regional healthcare is that things that the city takes for granted, we've got to start to have that lens as well over to rural and regional healthcare. You can't have a Westmead in every town or village. I know that. People who I've met over the last 4 years as the Shadow Minister and then in the last 8 weeks as a Minister understand that better than most. Mr Speaker, one of the beauties of being a Shadow Minister for so long is I've had a very, very deep engagement with many, many people in rural and remote New South Wales. What they often tell me is, no, we don't need a Westmead in every town or village. But, Ryan, one of the challenges we have is that services that we were getting 25, 30 years ago have been taken away, and it would be good to get some of those back. So I want to end by saying this. I'm going to look at this carefully and have ongoing discussions with the member for Wagga Wagga. I'm going to make sure that a priority is placed on rural and regional healthcare within New South Wales Health. I think we've got a lot more work to do. I think we can do a lot better than what we're doing. I'm really happy that the member for Wagga Wagga and I think the member for Murray is going to be on a Legislative Assembly committee looking at the implementation of our rural and regional health inquiry. And I want to thank all of you for the way in which we've debated this today, and thank you for your advocacy on behalf of rural and regional New South Wales.
I thank the Minister. I call the member for Wagga Wagga in reply.
Thank you, Mr Speaker, and I'd like to begin by thanking the Minister for his reply and look forward to the successful conclusion from that, Minister. Thank you very much. And also I'd like to acknowledge my colleagues, the members for Bega, Murray, the Blue Mountains and Cootamundra for their words. Mr Speaker, it was not even a year that we've amassed 12,000 signatures, and that's due to the hard work of a whole lot of people. I'd like to begin by acknowledging that I started this petition with the member for Murray, Helen Dalton, who's in the chamber, spoke, and I'd just like to thank her for her support. Of course, the situation with Griffith was resolved during the petition, but we worked to get it going at the start, and I'd like to thank her for her support. And I'd also like to acknowledge that members of her community in Griffith contributed to the building of the centre originally, and I'd also like to acknowledge the members of the members of the Cootamundra electorate and acknowledge the contribution of the member for Cootamundra and the support of the can assist branches there and the people of her electorate who've contributed to this centre and for whom this is such a vital issue. I'd like to finish by thanking all those who've contributed to the collection of the signatures, Mr Speaker, and I've got some names here. I'm sure I've not covered everyone, but I just want to acknowledge Ms Debbie Robinson, Ms Cindy Flint, Alan Lane, Nola Baker, Rod Blundell, Anne Hallard, Andrea Sturgis, Jane Litchkey, Judy Pygram, Leoneus, Catherine Goss, the late Mr Peter Maloney, who helped me go round to practices to get this petition signed and who sadly passed away earlier this year, Susan Gannon and Dr Saba Nabi. They're just a few of the people. And I'd also like to acknowledge Annette St Clair and Judy Ann Emberson, long-term advocates for cancer in our electorate. I'd also like to acknowledge Can Assist, and Emma Phillips is here with her team. The work they've done to support people in our region is phenomenal, and that includes Margaret Dalmo and the team at Lilia Lodge. I also want to thank the people from Cancer Council New South Wales for the work that they've done. And I acknowledge Mr Tony Noon, who's been with Riverina Cancer Care Centre since the beginning. Look, I'm pleased the situation, Mr Speaker, has been resolved for Griffith, but as the Minister himself acknowledged, we can do better on this for Wagga. We need to do better on this for Wagga. It's an unfair situation. It's just not acceptable. And I commend the motion to take note of the petition to the House. Thank you, Mr Speaker.
I thank the member for Wagga Wagga. The question is that the House take note of the petition. All of that opinion say aye. To the contrary, no. I think the ayes have it. The ayes have it. The debate on the 10,000 signature petition, paper petition on the eliminating patient costs for radiation treatment at Wagga Wagga and Griffith's Cancer Treatment Centres having concluded. I wish to thank the guests in the gallery who visited to listen to the debate, and I imagine many of you travelled quite some distance to do that, so I certainly acknowledge the additional effort that you've gone to for that. Thank you very much.